Commissioner Anderson,
Present.
Commissioner Colleen,
Here.
Chair Baker McCormick.
Here,
You have a quorum present.
thank you. Next item.
B, Chairwoman's remarks.
Have none. Next item.
C, approval of the August 9th, 2022 meeting minutes.
Been moved and supported. All those in favor? Any opposed? Any abstentions? Motion passed. Next item, please.
D, unfinished business. There is none listed.
Thank you. Next item.
Item 1, under new business, requesting commission approval of a grant agreement with the Michigan Department of Health and Human Services.
Thank you. For this item, if we can have someone from the administration just speak to the local community stabilization grant. Thank you.
These are funds that we received from MDHHS to supplement essential local public health services and to offset some of the operation and administration costs of some of our required programming in public health, for example, food, communicable disease work, hearing and vision. And so this is it's outside of our comprehensive grant that we receive annually from MDHHS to supplement those essential local public health services.
Are there any questions from commissioners? All right, the food safety portion of the grant, what do you do in relation to food safety, just so?
Yeah, absolutely.
We understand.
So, yeah, our food safety program is a very large component of our environmental health unit. And so we are required to do the inspections, food inspections, licensing for food establishments in Outwayne County. And we do various case investigations when they involve a food-related outbreak in our jurisdiction.
Okay, so with the E. coli breakout, are you working on that currently, or any issues in Wayne County related to that?
Yeah, absolutely. So our environmental health team, so our food chief and our communicable disease lead and myself are, coordinating with the state. So this is at the state and FDA level in this ongoing investigation. The outbreak right now is in Michigan, Ohio, and I believe Indiana had some cases as well. So it's kind of evolving. We do have some cases in Outwayne County that we're following and monitoring and working on case investigation and inspections and whatnot.
Okay. And as far as our hearing and vision programs, due to COVID, I know we kind of fell off, but maybe we're at full capacity now. I haven't really heard much about what we're doing in that area either.
Yeah, so that is one of our other required services that we provide in public health. And as you mentioned early on in the pandemic, a lot of those services are provided in the schools where we screen at the required time intervals all our children for hearing issues and vision issues. The schools were rightfully wary of inviting large external groups inside. So some of our in-school services were put on pause, but we are back engaging in schools, inside schools, any schools that would welcome us. And we also provide services on site at the clinic too. But our biggest effort is in the schools because that's the most convenient place to screen large numbers of kids and make sure all our kids are reached.
So is it that the schools need to reach out to us, or do we reach out every year and let the schools know that we have this hearing and testing of vision programs?
Yeah, so our team proactively engages with the schools in the school district.
Great. Thank you. Any questions from commissioners? Yes, Commissioner Dodd.
Thank you, Madam Chair. In our analysis, it says that we received, or these funds are from back in December 2019. So was there not a like a requirement on when we have to spend these funds?
Yes, so this is awarded during this 21-22 fiscal year. So this is within our fiscal year award for this amount that's at commission today.
Okay.
So the plan is to spend these funds by the end of this fiscal year.
Okay, thank you.
Questions?
Sure.
Oh, I'm sorry. Yes. I'm sorry, Commissioner.
Hi.
You know, everybody's on this side.
Right.
So my apologies,
appreciate it.
Commissioner Anderson.
No problem. Does the health department, at this division, do they still do inspections at festivals and things like that? Public open air events?
Yeah, so part of, that's a multi-layered process where people are getting permits from their, municipalities and whatnot. And we do get involved if there's any food safety issues that are happening in those outdoor events as well.
Okay. All right. Thank you.
Thank you, Commissioner Anderson. All right, I think that was all the questions we had in relation. Oh, I'm sorry. Vice Chair, Commissioner Killeen.
Thank you, Madam Chair.
Mhm.
You referenced the annual, and I forget the whole comprehensive, what was the whole title of that thing we do annually?
Yeah, it's CPBC
Yeah, but-
and I think comprehensive planning and, I probably have to pull the actual, what it
Yeah,
stands
yeah.
for, but it's at the comprehensive agreement that we receive annually.
And when we see money coming in the form of a grant from the state, it will say, this is amendment 2
Mhm.
to the CPBC, if I remember correctly, or amendment 3. I didn't see that here, that it was an amendment. Instead, I see the verbiage, local community stabilization authority. Is this the CPBC, if I have that?
Yeah, that is correct. It
That
is
is what this
CPBC.
is.
Yeah, and so this is different than our CPBC.
Yeah,
So,
that's what I,
yeah,
since I
yes.
didn't see that in there, I thought, well, this can't be the same thing.
It isn't the same thing, and you're right. And so our CPBC, we are awarded annually, which includes funding, core funding for these essential local public health services,
Right.
amongst other funding that we annually get from the state. This is outside of that agreement.
Yeah.
It is administered a bit differently from the state level. It's this local community stabilization authority, which is this metropolitan government entity that levies a certain tax that gets put out to local government units, including local health departments, to supplement essential services.
As I see in the paperwork for this, outside of the CPBC or whatever, this is the third time the county has, in the last 10 years or something, received money through this. So is this something we apply for?
No.
Because like with the CPBC, they just send us money. They go,
Yes.
okay, we're amending it. Here's more money. But what's the process for accessing these funds from the state of Michigan?
So there's no application. We are just awarded by a state formula. The local jurisdictions are awarded based on a formula that is decided at the state level, and we receive it. So there's no application.
And they do this with counties all over the state.
They do.
And this is not revenue sharing. It just seems like it's a miracle that it popped up. Does this local, it's an authority, the local community stabilization authority. So they have their own board and they make their own decisions.
So if I could just add to that, My name is Melita Jordan. I'm the Director for the Department of Health, Human and Veteran Services. So Commissioner Colleen, I was just surprised as well, but Dr. Seth and I both met with the state to get an understanding of this particular grant, and she's right. We do not have to apply for it. It is based on some type of formula and tax, and so each county does receive money locally for it that you can then add and supplement to work on those things at the local public health level. And so it has been something that has been going on for a number of years that the counties have received. And so it is I'm not going to call it a windfall because it's not always the same amount of money, but it is an allocation that is provided to the counties to be able to supplement the work at that local level. And so I will say that, as you know, I'm new. Dr. Seth is new and learning all of this as well, but we both took what I call the state budget review information so that we could have an understanding of it and also to figure out how we could spend these dollars. And so therefore it is put back into the local economy in terms of the local public health work to help supplement the current things that we already have on our plate as it relates to food safety, as she mentioned, as well as some of the other local public health activities that we do. And I'm like her, I don't know all the acronyms either. I'd have to have it spelled out in front of me, but absolutely, this is something that's there.
And if we could get, Madam Chair, for commissioners to understand this, because certainly this is not like an annual allocation. We don't get some sort of allocation annually. So I'd kind of like to know who
through the chair of Commissioner Colleen.
Community Stabilization Authority is, what kind of authority they have, where do they get their funding from, how is it allocated out? Because with that local stabilization authority name, that doesn't scream to me that this is Health and Human Services stuff. It screams to me that it could be a lot of things. So I need some background on this local Community Stabilization Authority. Who are they? How do they get money? How are they? What's the law around how they disperse that out?
I will make sure that you get additional information that you're asking for. And if there is a law, we'll make sure that we do that as well.
But
excuse me?
Our commission staff may have that too. This would be all public documents, but
it maybe the analysis part could, of our staff could, go
Through the
ahead.
chair, I believe Attorney Winter, who works with the department, was trying to get your attention. I think I see him on Zoom right now.
Okay.
Yes,
To weigh in.
Okay. Can we?
through the chair, I researched this 3 years ago and presented it to
Can you
HHS.
give your name and title for the
Yes.
record?
TR Winter, lead attorney from Corporation Counsel. When this money first became available to the health department 3 years ago, I researched and presented in front of this committee. There are stabilization funds that are guaranteed in the Michigan Constitution. These are not those funds. There were statutory changes made about 5 to 10 years ago that started this supplemental stabilization funding. It was initially by statute not provided to the health departments, but provided to local governments. The statute said that as of the date 3 or 4 years ago, the local health departments would start to get a piece of that stabilization funding per state statute. In about 2019, we were sent the first money transfer. I think it was a check and there was really nothing attached to it, and we had to research what it was. It typically has been about $700,000 to $800,000 each of these years, and it is in the statute that it is designated for the mandated public health department activities, this particular chunk of money.
well, again, Madam Chair, I'd like to get some of the background because I don't, hearing Counselor Winter talk, I don't know if is this local Community Stabilization Authority now solely funding for public health? Do they fund for other things? Do they have a board? What's their statutory what's the law that establishes them and says what they're supposed to do. So if we can get more of that background, just to understand these funding sources a little bit better.
Mr. Winters, would you happen to have any of that information?
Yes, I believe so. I can pull out the research I did for this committee 3 years ago. I believe it lists the statutes, and yes, the other money started to come to municipalities separately from this several years before the designation money for the health departments kicked in, and that was written in the statute that health departments didn't get anything until I think 2018 or 19 when we got our first check.
Thank you. If you can send that to all commissioners, I guess that would be good information for us to have.
I will.
All right. Thank
Madam
you.
Chair.
Thank you, Commissioner Colleen. And any other commissioners? All right. Well, thank you, Director Jordan and Dr. Seth. All right. We will now take a motion to approve this item.
Move to accept the grant, Madam Chair.
Support.
It's been moved and supported. All those in favor? Any opposed? Any abstentions? And there are none. Motion pass. Next item.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item, please.
Public comments.
Right, if there's anyone in the audience here today that would like to make a comment? Anyone? No one in the audience? Anyone on Zoom? Or any emails?
No emails.
And no one on Zoom?
Body indicating that they would like to speak.
Right. Next item.
Adjournment.